Hello and welcome to the 68th Bi-Monthly Breastfeeding Coalition's webinar. I'm Kinkini Banerjee, the Coalition's Relations Director at USBC, and I'm so glad to welcome you to this session. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity and by the USBC. The webinars referred to as the 222 are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of this series is to bring together breastfeeding coalitions, national and regional organizations to share best practices in breastfeeding, promotion, protection, and support, and to network and collaborate on issues of national significance. All the webinars are free, and coalition members, maternal child health advocates, and any interested supporter of MCH and breastfeeding from around the country are welcome to join us for these free webinar sessions. You could either find the info on our USBC public website page, which is usbreastfeeding.org/coalitions-webinar, or you can also join our Coalition Learning Connection and get the info. So the Learning Connection needs a few seconds. You need a user account, and it takes just a few seconds to get connected to to be part of the Coalition Learning Connection. And a great part of being part of the CLC is that there are discussion forums, and there's a lot of peer sharing of resources and conversations that happen that you can also participate in. To streamline access, these webinars have been set up as a series, so you don't have to register for each separate session. Once you register, you're set for the entire series, and you'll receive reminders for before each webinar with the topic and speaker details. And we understand that it's in the middle of the day and it's not possible to attend every session live. So there is easy access to all of our archived recordings as well. And the presentation handouts and video recordings of this and past sessions can be found on the Coalition's webinar page. Our operations manager, Dinesh Schmidt, has also posted the link in the chat box. So if you click on that link, you can find today's PDF of today's webinar presentation as well. So if you go to our website, this is how you can, you'll see the tabs across the top. Go to the one that is the coalitions, and then click on that, and it'll open up a drop-down menu, and you'll see the different webinar series that we have. So click on the CDC one, and it should open up the page to that directly. So we have a large number of participants in today's webinar, and so you are in listen-only mode, which means that you can hear us, but we can't hear you. We want this session to be as interactive as possible. We have 15 minutes set for Q&A at the end of the presentation, and I encourage you to submit your questions at any time as they come up for you during the session. So please type your questions. You should see a questions box on the control panel, and here's how you get to it. So on the right side of your screen, you should see a control panel. If you don't see it, it might be minimized. So click on that orange tab with the white arrow, and it'll pop back out, and scroll down the different tabs on that control panel. And just under the audio section, you'll see a tab for questions. When you click on that questions tab, it'll open up a text box for you to type in. During this session, if you have any audio or tech problems, send us a message either using the chat function here, or the question section, or you can also email us at coalitions@usbreastfeeding.org, and our staff will do their best to help you. Okay, and that brings me to today's topic, building a breastfeeding support program within a Wisconsin tribal health setting. Today, we'll hear insights from Wisconsin about how the Native Breastfeeding Coalition of Wisconsin, the Ho-Chunk Nation Breastfeeding Coalition, the Wisconsin State Breastfeeding Coalition, and the Wisconsin State Health Department, MCH, are all working together. Our presenters will share their experience building a breastfeeding support program within a tribal health setting and community. We will learn about community assessments that were done, how local champions supported the efforts to set up lactation rooms, at tribal community buildings and gaming sites, and how policies were created. We will learn why system changes that promote, protect, and support breastfeeding are so vital to the health of our communities. And I am delighted to introduce today's presenters. Shawn Meyer works for the Wisconsin's Department of Health Services, the MCH program, as their maternal child health nurse consultant. She's the lead for the Breastfeeding National Performance Measure, working with local and tribal agencies to increase breastfeeding rates in the state of Wisconsin. Shawn is a member of the Turtle Mountain Band of the Chippewa and has worked in tribal healthcare for over 10 years. She's a certified lactation counselor since 2008 and works with Native families to preserve breastfeeding as a cultural tradition and to help mothers meet their breastfeeding goals. Shawn is also an at-large MCH rep on the Wisconsin Breastfeeding Coalition. She's a member of the Native Breastfeeding Coalition of Wisconsin. Shawn was also a recipient of the Tribal Trailblazer Award from USBC in 2014, and we are so lucky to partner with Shawn. Our other presenter is Allie Isaacson, who has worked with the Ho-Chunk Nation as a maternal child health nurse and certified lactation counselor since 2012. Allie works closely with Native families during the prenatal and postpartum periods and beyond to help improve health outcomes and provide support to breastfeeding mothers to help them reach their breastfeeding goals. Allie has served as the chair of the Ho-Chunk Nation Breastfeeding Coalition and has dedicated much time to improving worksite lactation standards for the Ho-Chunk Nation. She's the 2018 chair for the Wisconsin Breastfeeding Coalition and is a member of the Native Breastfeeding Coalition of Wisconsin. Allie and her husband are proud parents of 2 happy, healthy, breastfed little girls. And we've been so lucky again to have Allie and Shawn present at our national conference. So if you can go to to our archives again and see their fabulous presentation of the program at the Ho-Chunk Nation, some of which that they will be talking about today. So with that, I'm going to turn it over to Shawn and Allie. Welcome.
Thank you, Kinney. This is Shawn.
Hi, everyone. This is Allie, and we are really excited to share our experience with you about building a breastfeeding support program.
One quick note, Kinney, I'm not getting the link to take the screen. There we go. There we go. I think we're all set. So first, we want to start by giving you an overview of the breastfeeding efforts in Wisconsin. And as Kinney mentioned, there's a lot of collaboration in Wisconsin, including our Maternal and Child Health Program, the Wisconsin Breastfeeding Coalition, the Native Breastfeeding Coalition of Wisconsin, and the Ho-Chunk Nation Breastfeeding Coalition. Breastfeeding is a national performance measure for the Title V Maternal Child Health Program in Wisconsin. And in 2015, the MCH needs assessment process identified that too few Wisconsin infants receive breast milk and are breastfed exclusively through 6 months. The rate of infants that have ever breastfed in Wisconsin is lower than the national average, and disparities exist. Local and tribal agencies have reported that building a successful breastfeeding support program depends on connecting with others who value breastfeeding, finding a champion in the community, and taking a multi-level approach. There was strong interest among tribal health agencies to increase breastfeeding rates within the Native American population and decrease disparities. And since 2016, local and tribal health agencies have utilized the Title V MCH block grant funding to implement system building activities to support breastfeeding. Agencies work within their communities with their partners to collaborate with other organizations to support breastfeeding friendly work sites and childcare sites. Partnering with local breastfeeding coalitions, collaborating with human resource departments, and reaching out to child care agencies were some of the actions local and tribal agencies completed to help increase breastfeeding rates within our state. So you can see some of those things noted on the slide, and we also just want to note that we are participating in the Healthy Children's Weight Coin, focusing on breastfeeding. The COIN is the Collaborative Improvement and Innovative Network, and that's being supported by the ASPHN, or the Association of State Public Health Nutritionists, and we're focusing on the work stream breastfeeding in Wisconsin. And also another QI effort that we wanted to note was that last year the Wisconsin Department of Children and Families Home Visiting Program also participated in a COIN that focused on breastfeeding, and they're wrapping up the results of that COIN this month, and so we'll have data to share about the home visiting program and their efforts.
So as Shawn mentioned on the last slide, the Wisconsin Breastfeeding Coalition is an active partner with the state MCH program. WBC actually created an ad hoc worksite committee to collaborate statewide efforts for the Children's Healthy Weight Coin. I have here the Wisconsin Breastfeeding Coalition mission and vision. So the mission of the Wisconsin Breastfeeding Coalition is to improve the health of Wisconsin by working collaboratively to protect, promote, and support breastfeeding. And our vision is, in order to achieve optimal health, enhance child development, promote effective parenting, and make optimal use of resources, breastfeeding will be the norm for infant and early childhood feeding in Wisconsin. So the Wisconsin Breastfeeding Coalition worked last year with the Healthy Wisconsin Leadership Institute to build and restructure our coalition with a health equity lens. And an example of that is that as we were looking at our bylaws and our charters, we made sure to incorporate an inclusivity statement, and we're working to expand our membership reach.
We're really excited about this next slide and sharing a little bit about the Native Breastfeeding Coalition of Wisconsin. The coalition was founded by Breastfeeding the Traditional Way, a program of Great Lakes Intertribal Council, otherwise known as GLTC, and funded by the W.K. Kellogg Foundation. And members of GLTC include all 11 federally recognized tribes within Wisconsin, as well as one tribe in Upper Michigan. The mission of the coalition is to strengthen and encourage the traditional practice of breastfeeding to improve the lives of women, babies, and families for generations to come. The vision is that Native communities support breast milk as the first food to nourish our mind, body, and spirit. The goal of the Breastfeeding Traditional Way is to improve the length of time a mother breastfeeds her baby. And improving these duration rates can minimize the health disparities among tribal people. This coalition is doing amazing work in the short time that they've been funded and created, and they have provided education, trainings, and support throughout Wisconsin. Some of their activities are highlighted here and include distributing breastfeeding surveys at all Wisconsin tribal sites to collect Native-specific data on breastfeeding. They offer the baby breastfeeding classes, and that has a Native focus on providing breastfeeding support and education to tribal mothers. And they held a very successful certified lactation specialist training, and over 40 participants that served tribal sites completed the training.
All right, so going to get into just a little bit of data. I just want to touch on it here. So as you guys can see, I have national data and I have Native American data here. And it is seen across the boards that there is some disparity, especially with initiation rates and then at 6 months. And these numbers are getting a little dated. They're from the Healthy People 2020. And when I checked, the most recent numbers are still from 2011. So unfortunately, this is one of our better sources of data for Native Americans because it is challenging to find Native-specific data that's extracted out. A lot of times it's lumped in with that other category. And then from there, to get tribal specific data is even more challenging. So Native American data may not even be reflective of the tribe that you're working with. And as mentioned on the previous slide, it can be challenging to capture Native specific data. So this slide is actually showing WIC numbers, comparing the GLTC WIC program to state WIC numbers. So that being said, again, it's not the best reflection of data for Wisconsin overall. I mean, specifically, if we look at exclusive breastfeeding at 6 months in the state of Wisconsin, it's 26.6%. And for our Native American population in Wisconsin on WIC, it's 7.8%. So a huge disparity there. One way that we are addressing the lack of good data is that the Native Breastfeeding Coalition of Wisconsin is gathering data through their breastfeeding survey. So all of the tribes, like Shawn said, were given surveys, and they are working on collecting those at this time, and hopefully we'll be seeing some data in the next several months. So we're really excited about that. All right, so now we're going to take a look at a local example with how the Ho-Chunk Nation has addressed breastfeeding disparities. The Ho-Chunk Nation established their breastfeeding coalition in 2008. Our mission is to support and promote a breastfeeding-friendly environment within the Ho-Chunk Nation community and workplaces. It started out with a small group of healthcare professionals that had an interest in breastfeeding, including community health nurses, nutrition, registered dietitians, family physician, and since 2008, the coalition has grown and expanded their reach. Just to take a step back real quick, I want to give a little bit of information about the Ho-Chunk Nation. So Ho-Chunk Nation tribe one time occupied lands in Wisconsin, Iowa, South Dakota, Minnesota, Nebraska, and Illinois. They were removed 11 times, and they continued to return to Wisconsin. At one point, the nation split, with part of the tribe returning to Wisconsin and part moving to a reservation in Nebraska. So for about 360 years, the nation was actually labeled as the Winnebago tribe. In 1993, the nation reclaimed their original name, Ho-Chunk Nation, which means people of the big voice. Today, the Ho-Chunk Nation does not have a reservation, but rather have reclaimed tribal lands. Enrollment is a little over 5,000 members in Wisconsin, and they employ over 3,400 people. The Ho-Chunk Nation Health Department covers 16 counties in its service district area with 6 health office locations. So if you guys take a look at the map there, Wisconsin is a pretty big state geographically, and so we have our work cut out for us covering all of those counties. So the Ho-Chunk Nation Breastfeeding Coalition has 3 focus areas. Their coalition infrastructure, working with Native families, and working with our Ho-Chunk Nation work sites.
So now we'll share a little bit about just how the coalition was established and where things are at now. So establishing the coalition focused on 2 areas: formalizing the coalition and membership. Meeting structure included establishing a set quarterly meeting time, providing the technology for everyone to participate in either person or over the phone, because if you think about the last slide and how the Ho-Chunk Nation Health Department is covering 16 counties, we wanted to make sure that there weren't any obstacles for participation, so we always provided a phone line and some technology to support those efforts. Taking formal notes and providing them to members at each meeting was also part of the formalizing the meeting structure. We also recognize the importance of formalizing our relationships, not just locally, but at the state and national level. Partnerships with statewide and national organizations were established with the Wisconsin Breastfeeding Coalition and USBC. Partnering with local county coalitions also expanded our reach. And additional ways we worked to formalize the coalition included working on bylaws, creating our mission and vision statements, and including breastfeeding efforts in our strategic plan for the community health nursing program. And membership focused initially on internal departments, so we wanted to really bring together all of the departments because, as Allie noted, the health offices are in 6 different locations, and so our staff is really widespread. And so at that time, we really wanted to draw the staff in and work internally. And so members included nutrition and community health nursing staff. Some of those had CLCs, and some of those went to training, and we made that a priority. And then also finding a Ho-Chunk Nation champion in Dr. Amy DeLong, who's a Ho-Chunk Nation member and family physician, including healthcare team members at all sites, and then also including our WIC peer counselor.
One of our primary focuses, of course, is working with Native families. So it was, you know, a pretty natural partnership with the 2 clinics. So within the 6 health offices, 2 of our larger sites have clinics with providers that do OB care. And so we typically receive referrals early on during the prenatal period, and then we begin seeing those patients and, you know, start a dialogue with open communication about benefits of breastfeeding and often discuss their breastfeeding goals. We educate on the support available to them through home and office visits from CLC staff, and always keeping in mind the patient-centered model. We do group education through our Partners in Parenting class. It's a monthly session for Native families in a fun, informal setting to talk about topics related to parenthood. The great thing about our Partners in Parenting class is it's kind of doubles as education and support group. So we have a lot of families who come, and it gives them an opportunity to talk to each other and share their experiences. We usually have a nurse and a dietitian there, one of our health educators, and then just depending who our presenter. And so it's nice because it gives families the opportunity to just, you know, talk to their providers that they're working with and ask questions. So it's got a really nice, relaxed feeling and, you know, takes some pressure off of them. We also host some breastfeeding events throughout the year. We usually do something big for World Breastfeeding Week. We also focus on outreach to the community through health fairs. We have a health website. We do have a social media presence. We have a Facebook page, Ho-Chunk Nation Maternal Child Health Program. And we also work with our tribal newspaper to advertise our programs, resources, and events. We have good relationships with some of our local hospitals, and we do typically receive referrals upon discharge for postpartum and breastfeeding follow-up. Usually with the initial postpartum visit, we always like to make sure we take into account cultural considerations, and that's something that, you know, we as a tribal health department can do better than some of the counties in the areas we cover. And so we always make sure we bring a gift the first time we're seeing the baby, and usually in that gift we're including some breastfeeding goodies like milk storage bags, nursing pads, breastfeeding education, like we'll give a milk storage magnet, door hangers if we know they're working moms, things like that. And we do also assist moms with obtaining breast pumps through either Badger Care, WIC, or private insurance if they are going to be returning to work. So obviously we know many mothers who return to work abandon breastfeeding partially or completely because they do not have sufficient time or a place to breastfeed or express and store their milk. Mothers need a safe and clean and private place in or near their workplace to continue breastfeeding. Enabling conditions at work such as paid maternity leave, facilities for expressing and storing breast milk, and breastfeeding breaks can all help. So naturally that gave us a great platform to focus our efforts on our work sites. We began by doing annual worksite assessments at all of our gaming facilities and health offices. We started to expand to other locations such as branch offices, community centers, and tribal office buildings throughout the tribe. In the last several years, we've had a lot of new constructions and renovation projects that have been taking place. So we've been working closely with those project managers at each location to provide information on lactation room requirements, We always let them know, hey, we have a policy for breastfeeding employees, and that the federal law, we need to be providing a space for moms to pump. And then usually I send them some stuff from the business case for breastfeeding, and then offer support and education as they go through the process. So I'm working pretty closely with a project manager at one of our larger gaming facilities right now, and we've been emailing back and forth for several months, and he'll be like, okay, now what should I get for a chair? And so I'll send some examples along and some different options at different price points, and so he's been really great to work with. I would really like to, in the future, look at establishing with our tribal planning and zoning committee so that we could just include an ordinance that new constructions would include space for lactation room. Right now, sometimes it's kind of an afterthought, like, hey, we need to, I hear you guys are doing a renovation. Can we talk about if we could include a space for breastfeeding moms? Another thing is, kind of back to breast pumps, the Ho-Chunk Nation Health Insurance covers pumps at 100%, which is really awesome. And we've developed a form for employees to easily access their insurance benefit. We work with employees in all of our areas to find a DME provider. In some of our rural areas where DME providers are sparse, we'll work with mail order DME suppliers so that we kind of are taking away some of those obstacles for moms to get pumps if they need for going back to work. And then finally, we recently had, we always have nursing students, and we recently had a couple students from the University of Wisconsin-Madison, and they assisted us with developing a training module based on the business case for breastfeeding that we will utilize with supervisors and HR staff to better educate them on the policy. We're working and collaborating with our human resources to include packets about breastfeeding in the family medical leave paperwork. So when a mom's coming in to fill paperwork out for maternity leave, she's automatically going to be getting some breastfeeding resources that we offer within the tribe.
So getting back to the policy change that the Ho-Chunk Nation did, the workplace assessment that was completed at the Ho-Chunk Nation did show a need for a policy that would affect all Ho-Chunk Nation workplaces. So a tribal setting is a little bit different because you'll often have not only the health department, but also administrative buildings and staff, and also gaming buildings and staff. The business case for breastfeeding template was utilized to submit a policy for supporting breastfeeding employees. The initial proposal detailed lactation room requirements and employee benefits and was quite extensive, and it ultimately resulted in the following statement. So you see that highlighted here on our slide. And there's a couple key points that when this was put through in September 2016, a couple key points to keep in mind were that if you look, just reading through it, the Ho-Chunk Nation provides a supportive environment to enable breastfeeding employees to express their milk during work hours. So we really liked how the Ho-Chunk Nation phrased that, because they are declaring their support and then also saying that employees have the right to pump during work hours, which is really an important way to word it in the policy. And also that the program is administered by the Ho-Chunk Nation Maternal and Child Health Program within the Community Health Nursing Program. So it gives clear direction on where a supervisor can go for support, like Allie's example in working with one of the gaming supervisors. And that this policy shall be communicated not only to current employees, but also during a new employee orientation. So this was a really exciting marker in the Ho-Chunk Nation employee worksite strategy and changes. And also at that time, the Ho-Chunk Nation increased their paid maternity leave from 1 week to 3 weeks. And then also in this ERA, it's noted that a mother that is breastfeeding can have her baby brought to her work site to breastfeed up until a year old. So those are some really exciting changes in the policy for the Ho-Chunk Nation. And having a local breastfeeding champion at the Ho-Chunk Nation with Dr. Amy DeLong, she was really key in getting all of these policies in place and supporting it.
So the Ho-Chunk Nation Breastfeeding Coalition and the MCH program provide support and education materials and guidance in establishing our lactation rooms. We have worked with each site to establish spaces, whether it be a designated space that may serve other purposes, or in some locations, a dedicated space. Depends on the location. In some places, we've had to get a little more creative to make a space work. We've modified storage rooms, exam rooms, or personal offices. Actually, the bottom left photo was previously a storage room. And so we worked with the building manager at that site to get a lock put on the door. And then we were able to furnish it. And it's rather simple, but it serves the purpose, and the moms over there really appreciate it. It's probably one of our busier rooms. That area employs a lot of young females. And then we always make sure to kind of check up on our rooms. We'll put education and resources in there. And when we're able to, sometimes we'll have some breastfeeding supplies like milk storage bags, or again, the storage magnets. And oh yeah, sorry, Shawn's reminding me, and the quick clean wipes, because as you can see, that room does not have a sink. So so we at least try to offer quick clean wipes too in some of our areas to have those available. So again, it depends on the location. And everybody's really been willing to work with us to accommodate the requirements. We found that even if they don't currently have a breastfeeding mom at their location, we still like to encourage them to have a designated space so that when the occasion arises, there's no hoops for that mom to jump through. She's not going, okay, when I go back to work, I don't have anywhere to pump. So we just have, each site has a designated space. The picture on the right is actually one of our clinics. And that site was recently had a renovation, and we included a lactation room. So that one was nice. We were able to get a sink put in there and furnish it. And that is a really busy room, because that's the site where I work, and we've actually had to get a sign up because it's occupied all the time. With the gaming facilities, one barrier that we found is that we have locations for most of for our employees to pump, but we really don't have anything for patrons. So that's something that we would like to look into a little more in the future. I don't know, maybe some mama pods or something, but at least we have our employees covered at all of our gaming facilities and health offices. So we're really proud of that. In all of our work within the tribal setting, we want to make sure that the tribe we're representing has a voice at the table. So whether it's through policy changes and making sure that all moms are afforded the right to express milk at work and feel supported to do so, or just developing our partnerships, we're really trying to bring more voices to the table and include Ho-Chunk moms. We want to represent the experiences of all those that we're trying to impact. And an example of this is while we were developing our training platform with the University of Wisconsin nursing students, we conducted interviews with supervisors, moms, and other Ho-Chunk employees. We want to make sure that we're moving from just engagement to empowerment and adjusting the organizational culture so that we're not working in silos. And we're always keeping in mind that the employees making the changes are not always tribal. So we want to make sure that the tribal needs are being met.
As Allie has mentioned, the collaborative efforts with local universities, including the University of Wisconsin. The Ho-Chunk Nation also worked closely with Viterbo University. And as many of our local and tribal agencies work with local universities and precept nursing students, this relationship can be really valuable in creating and coordinating projects. So in collaboration with Viterbo University, we had a nursing student named Barry Stahl, and he was a videographer by trade and had returned to go to nursing school. And he was kind enough to take on creating the Benefits of Breastfeeding DVD for his Community Help Nursing project. So this highlights tribal mothers and fathers that were interviewed to determine why breastfeeding was important to them. These interviews were filmed and a 20-minute DVD was created that showed tribal members supporting breastfeeding in their own words. This DVD was viewed in clinics, posted on the tribal webpage, and used at individual visits. It was also distributed to other agencies working with Native American clients as a patient education resource. And I think Allie and I even brought it to the USBC conference and distributed it there in 2016. And so, you know, many sites are using digital storytelling and sharing short interviews with community members and making public service announcement posters highlighting community members. Those are all very powerful ways to work with the Native community and share the message of supporting breastfeeding. So in this following clip, you'll see Dr. Amy DeLong, who's the family physician. She has a master's in public health, and she is also a Ho-Chunk Nation member. And she was our breastfeeding champion at the Ho-Chunk Nation, and she shares the importance of preserving our tribal traditions through breastfeeding.
All right, I am Amy DeLong. I am a family physician and a public health professional. And I have 3 children, 12-year-old daughter and 9-year-old twins, boy and a girl. And I breastfed all 3 of them. I'm proud of that.
So, can you talk a little bit about preserving our Native traditions through breastfeeding?
Yes. Breastfeeding historically and traditionally for the Ho-Chunk people have always breastfed their children. And I remember at the time my mother had me, late 60s, that it was not the vogue thing to do to breastfeed your children. And she did, because she saw her mother do it and was not going to have it any other way. So in turn, when it came to be my turn, I chose the same thing. My passion is childhood obesity, and especially in American Indian children. And since 2003, American Indian children are the only group of ethnic minorities that have shown an increasing rate in obesity. And what the evidence has shown is that for every month an infant is breastfed, their risk for becoming obese or developing consequences of obesity like type 2 diabetes go down. So for me, breastfeeding is a public health issue, and there's evidence to show that it reduces obesity in that child, in that mother, and also prevents the mother from getting certain cancers, breast cancer and endometrial cancers.
In this next clip, we include an important message about not only the benefits of breastfeeding, but also the risks of formula feeding. And we were really excited that we could include the risks of formula feeding in this educational DVD.
We hear so much about the benefits of breastfeeding, and it's well known and evidence documented. What we don't hear are the risks of formula feeding, which really are increased infections, and like ear infections or pneumonia or asthma. So I want to make that counter argument that the benefits of breastfeeding are well known, and what we need to really put out there for our young moms who are on the fence about breastfeeding is that there are risks associated with formula feeding, and they deserve to know.
And we share this final clip on why Ho-Chunk Nation mothers choose to breastfeed.
Encourage women to think about the health benefits, not just for the child, but for you.
It takes a lot of patience, and I would say to not give up. I think that's the biggest thing you really do sacrifice a lot of your self-time because it takes a little bit longer, but it's so worth it. And I know
part of being a Ho-Chunk woman taking care of your child and wanting the best thing for your child. And breastfeeding is probably one of the greatest gifts that a mother can give her child at such a young age.
Breastfeeding is one way we can uphold our Ho-Chunk traditions. It also allows us to give our children the best start by giving them the best nutrition and nurturing them at the same time, both of which allow for their physical and emotional well-being.
So as you can see, we're very proud of the outcome of that DVD and felt like it really reflected the Ho-Chunk Nation values and traditions, and we worked hard to get a wide range of participants, that working moms and having a supportive father in the one clip, and having our Ho-Chunk Nation breastfeeding champion and Dr. DeLong making some really key statements. So we are open for questions.
Great. Thank you so much, Shawn and Allie, for that fantastic presentation and for sharing how the, just that network of engagement with the community and the partnerships and your big ideas are bringing transformative changes. So thank you again. There's a lot that the rest of us can learn from what's happening in Ho-Chunk Nation. So from your champions to your policies, to your practices, and just the breadth and depth of the work that you all are doing. So fantastic. I am going to invite Danae Schmidt to read the questions, because during this time my internet connection has gone. I'm on the phone. So Danae, if you can, so I can't see the screen. Sure. Thank goodness I have. I've been following along your slide deck. Go ahead, Danae.
Sure. So the first question is, can you give an example of your quality improvement initiatives that you've completed in your MCH program?
Are they referencing the Ho-Chunk Nation MCH program or the statewide MCH program?
It doesn't specify, but maybe we could touch on a bit of both.
Okay. Right now with the Wisconsin MCH program, we are participating in the COIN project with the work stream on breastfeeding as the primary driver. And so we're just getting started with that COIN that started in the fall with our first in-person session in January. And so our focus for that project is to establish a statewide collaborative efforts towards work sites. And so we're looking at a statewide recognition program, as well as more consistency in working with the MCH strategy of work sites. So with our MCH objective of breastfeeding, we have two strategies. We have work sites and childcare sites. And so with that COIN, we're emphasizing the work site part of the objective and focusing our efforts and trying to make that more consistent throughout the state.
And then an example of a QI project that we did within Ho-Chunk Maternal Child Health Program was actually working with our clinics and our providers, and that was to establish that referral system early on with our prenatal patients. So a lot of times we weren't getting connected with the moms until the postpartum period. And as some of us know, that's too late. We want to make sure that we're getting that early contact with them. So we worked with our providers and we set up a system so that they were sending the CLCs, so some of our dietitians or our CHN, or our community health nurses, were getting a referral. And while the patient would be in to see the provider at, like when she came in to do her glucose tolerance test, they would automatically meet with one of the CLCs at that time to establish care and then start discussing breastfeeding and feeding plans.
Great. Thanks so much. The next question is, are you able to share your worksite assessments with the group? This particular person is interested in how you all started working or how you started the conversation with the gaming facility.
Yeah, we would be happy to share that. It's pretty, we actually adapted it from another health department in Wisconsin, and that came about because we have learning community calls in the state of Wisconsin for everyone working on the breastfeeding initiative, and that was shared, and so we took it and adapted it, and then we started utilizing it, and really it ended up kind of can be used as a self-assessment, but what we found to be more effective was that if members of our coalition could make contact and meet with someone at that location and go out and help them do the assessment, we were more likely to get it back from the gaming facilities versus sending it to them and asking them to return it to us. So that was really effective, and we would be happy to share that. Can we?
Yeah, we can maybe send it to you, Danae, and it could be included in the notes.
Absolutely, that sounds great.
We'll plan to do that.
Some of the questions on the form were your privacy to express milk, flexible breaks, education that was available, regarding milk storage and breastfeeding, support, is there a written breastfeeding policy? Are there supportive practices that value breastfeeding? And then just another open question about any other concerns so that anything else could be captured that maybe, wasn't addressed in the standard form.
Great, awesome. We'll be happy to share that out with everyone. The next question asks, can you talk a little bit more about the process of getting the support for bringing babies to the workplace for up to 1 year? Was there a tribal resolution or a tribal council decision that was required, support required, that helped move that forward?
I have to be honest.
Pleasant surprise.
I'm really not sure. Yeah, it was a pleasant surprise because we had really focused on just the policy for expressing milk during work hours, and like I said, use the template from the business case for breastfeeding. And then as we were looking through the policy, there was a section that said something like, children are not allowed at work with their parents except in these circumstances, and it was listed very specifically. A mother was allowed to to have her child brought to her to breastfeed during work. And I was like, wow.
And it was up to a year old.
And it was, yes. And I wish I had more information on that. I could maybe do a little outreach and see how that came about, but it was really a pleasant surprise that somebody had included that. So I apologize. I don't have a better answer.
This is Kinkini. That's fantastic. We'd love to see that language and see how that was used. Thank you.
Okay, ladies, we have one more question, and that is, did you encounter any opposition or problems in implementing or engaging partners for the programs that you developed?
I think having, one of the key components to the success of the Ho-Chunk Nation was having a champion in the family physician, Dr. Amy DeLong, and that she was medical director of both clinics, and that she really had a heavy influence on any policy changes that could be implemented, and was very supportive in passing on policy changes, getting them to the right people at the right time. And timing really played a key factor as well.
Mm-hmm. And I would say too, in a way, we kind of developed a second breastfeeding champion. We had another, one of our directors, and her daughter came back to work and was starting to breastfeed. And she kind of came to us and was like, my daughter is going to be working at this building and there's nowhere for her to pump, and we need to fix this. And she had a big voice as well. And so I think it was just, you know, connecting with some of those key partners who had special interest in it. And I think that's a huge thing in the tribal community is finding those people who do have a big voice that you can partner with, and they can really move things along. So, and like Shawn said, a lot of times it's timing of it too. And if you're working with someone in some of those director positions, they are in the know of things like, oh, there's going to be a chance to submit for policy changes. So I think it's great to have a partner like that.
And another thing to note is that I think that as far as resistance to programs, I think that more so there was, you know, more support needed. So knowing who to go to ask for help. So as Allie gave the example of, you know, a gaming supervisor, gaming employees have very different rules and security rules that they have to follow in entering and leaving the floor. And so it's much different than, you know, our health employees that may have a private office to pump in, or administrative employees that may have a lactation room on site. And it was more of a matter of not so much resistance, but offering more support to supervisors and managers so that they could easily go to someone in the maternal child health program and ask any questions, and how, you know, and really supporting them in a way that you could provide education, but also some comfort in knowing that, you know, the space doesn't always have to be permanent, and because space is such a huge factor from a lot of places. And so knowing that they could have kind of an ebb and flow with as lactation services were needed at their site.
Mm-hmm. Excellent. Great. Thank you. So we have time for one more question before we move into some updates. Do any of the workplaces have the Infant at Work program?
So Infant at Work program, so you mean like being able to have your infant with you all day at work?
I'm not familiar with the program, so I would say no.
No problem, no problem.
Sorry about that.
No, not a problem at all.
Okay, let's continue. I had a question. Do we have time for one more question, Danae, before we jump into the updates?
Sure, go ahead.
Great. Well, thank you so much again, Shawn and Allie. I want to highlight two things. One is there's just so many things we can learn from what you all have done at Ho-Chunk Nation, but 3 weeks of paid leave, that is fantastic, to go from 1 to 3 again. That's great. And you spoke about, you know, the deep community partnerships and that with public health and healthcare, but I was also, you know, the partnerships that you have at University of Wisconsin as well as the tribal university seem like such great partnerships for sustainable change in for community change as well. So can you speak a little bit about how that came about? I know you mentioned Barry, Dr. Barry.
Sure. With the Ho-Chunk Nation Community Health Nursing Program is a preceptor site for Viterbo University, Edgewood College in Madison, and then also University of Wisconsin-Madison. So because the Ho-Chunk Nation provides care in 16 counties, many schools have access to our programs, as well as the Wisconsin Tech College for their 2-year program. So it's a really great experience for nursing students to come onto a tribal health program and learn about serving a specific community and learn more about health equity and all that is to be offered to a tribal community. And with that, most of the sites, when they're doing their public health nursing or community health nursing program, the students are required to do some sort of project. So either It depends on the university if it's an individual project or if they have multiple students located at a site, they may work together, such as UW or Edgewood. So we were really able, the Ho-Chunk Nation was able to really take advantage of that. And it was when I was working with the Ho-Chunk Nation that Barry was my student and was like, how, you know, I'm a videographer. How about a video for all your breastfeeding stuff you want to do? And I was so excited because it was just an opportunity. He had all the equipment, he had everything to provide us with that assistance. And so over the years of being a preceptor for nursing students, the Ho-Chunk Nation has really benefited from the projects and having the students on site in the community. Mm-hmm.
Great, thank you. I mean, this is all about coordination, collaboration, and partnerships. What a wonderful example, and thank you for that. I'm going to briefly give some USBC announcements. So, Danae, if you can show the screen on that. So, we're very, very happy again. In honor of Black History Month, the USBC is thrilled to recognize the work of our partners who are dedicated to disrupting structural racism and advancing equity in maternal and child health. So big shout out to Reaching Our Sisters Everywhere, Rose, Uzazi Village, Black Mothers Breastfeeding Association, Health Connect One, NAPLC, which is the National Association of Professional and Peer Lactation Supporters of Color, Indiana Black Breastfeeding Coalition, the Missouri Kansas Black Breastfeeding Coalition, B-Stars from Memphis in Tennessee, the Alameda County African American Breastfeeding Task Force, and all other organizations. So keep chatting us, any other organization that's doing the work to improve the lives of mothers, infants, children, and communities, especially in African American communities. I also wanted to share that NAPLC is their 2018 webinar series, Leading by Example, starts this February. On Feb 21st, they have a webinar called Taking the Leap, How to Launch a Lactation Practice. So I hope you'll be joining and checking out that webinar as well. NAPLC is a really fabulous partner and they have a lot of resources. Next slide, please. And I'm really happy to share this new infographic from CDC titled CDC's Work to Support and Promote Breastfeeding in Hospitals, Work Sites, and Communities. Again, share this and use this resource widely. It highlights the public health problem associated with low breastfeeding rates, the benefits of breastfeeding for mothers and babies, and the supports needed for moms to successfully breastfeed. This two-pager infographic outlines CDC's efforts to promote breastfeeding and notes the increases in initiation rates and the percentage of births in hospital with recommended care practices. So as you're working on your advocacy and your education and outreach efforts, I hope you'll do that. So continue to connect with us, please. Next slide, as you see. Subscribe to our wire, our action alerts. We now have been sending policy updates as well. Find your coalition. And again, thank you for all you do. Everything we do is about partnerships. So many thanks to Allie and Shawn, and many thanks to you for all that you do. We hope very much that these 222 webinars bring you ideas for collaborative action. Please complete the webinar evaluation and let us know how we are doing. We do read your suggestions and bring you the topics and speakers that are most relevant to you. You also get a certificate of attendance when you complete the evaluation. So thanks everyone. Goodbye for now, and I look forward to having you all for our next session. Thank you.